that's our next. We have Angela Bradshaw is going to launch the Alzheimer Europe report on data sharing in dementia research. So it's obviously very important today, given the speakers that we have, to launching such a report which reviews recent changes in EU research policy. And I know we're going to have recommendations as to how we can improve data sharing in the whole area of dementia research. So Angela, thank you. I look forward to hearing your contribution and your recommendations particularly.
Thank you very much, Deirdre, for the kind invitation, and thanks everyone else for your attention. So today Alzheimer Europe is launching our new report on data sharing in dementia research, and in my presentation I'll be taking you through some of the key findings and takeaways from that report. Apologies. There. So in our 2019 publication on the prevalence of dementia in Europe, we show that the number of people with dementia in Europe is likely to double by 2050, going from about 9.8 million to over 18 million people in the wider European region. Unfortunately, despite its increasing incidence, research on dementia receives a disproportionately low amount of funding compared to some other disease areas. A recent study from the UK published in 2018 showed that for every £10 in health and care costs incurred by dementia, dementia research receives just 8 pence compared to £1 and 7 pence for cancer, and I believe 65p for cardiovascular disease. There are similar figures in the US, and currently, as we all know, there are no disease-modifying treatments available for dementia. And although we know a little bit more about the measures that could prevent dementia, particularly after the publication of the Lancet Commission this year, we do need more research on the causes, diagnosis, prevention, and care of this disease. And as a result, there's really an urgent need to maximize the utility of data from dementia research. We believe that data sharing represents an important step towards meeting this need and could help us increase our understanding of the causes, treatment, prevention, and care of dementia. So the goal of this slide is to illustrate how the dementia research datascape has expanded since the beginning of the 20th century. So in 1906, Alois Alzheimer delivered a lecture on a 51-year-old woman called Oecd, who was living with a condition we now know as Alzheimer's disease. In his particular case study, there was one participant, Oecd. However, over time, you can see how the numbers of participants in research studies have grown. Going to 1972, the Drachman and Leavitt studies showing that the memory loss of Alzheimer's disease is different to the mild memory loss of healthy aging. That involved 48 participants. The Strittmeyer study that really helped us understand how the genetic risk factor ApoE4 affects the deposition of amyloid in the brain, that involved 174 participants. And then fast forward to the recent years, in 2018, a phase 2 study of an anti-amyloid immunotherapy involved over 800 participants. The EPAD longitudinal cohort study has over 2,000 participants, and studies that involve genome-wide association analyses. This is where you try to link genetic changes with symptoms or disease development. This particular study involved over 314,000 participants who all contribute data to the UK Biobank study. So as you can see from this graphic, the number of participants has grown substantially, but data sets have also grown a lot in complexity. So a report from 2018 showed that the number of clinical trial endpoints, so these are the measures that determine the success or the failure of a clinical trial, usually measures such as neuropsychological test data or brain scans. The number of these endpoints increased 86%, or it was 86% higher in 2015 compared to 2005. And this means that a single participant could undergo brain imaging. They could have neuropsychological tests as well as clinical tests like blood pressure measurements. And this means that there is unparalleled and unprecedented breadth and scale of data being generated from clinical research. And this really helps us get to the meaning of what causes dementia and what we can potentially do to either prevent or treat it. So data from these analyses can help researchers, for example, to identify connections between biomarkers, which you might measure in the blood, and the development of disease, such as is happening currently in the Alzheimer's Disease Neuroimaging Initiative. It can also help link early cognitive changes to the later development of dementia. So studies that are ongoing using the UK Biobank cohort are trying to do just this. However, there's a catch. In order to link the data, you need to share it, either between investigators or between clinical centers, also between countries. And this brings us on to the rationale and the aims of our report. So we know that from a large range of studies and reviews that there are clear benefits to data sharing. It helps research to be validated. It allows scientists to develop new hypotheses. It obviously increases the return on research investment. So if a data set can be reused, you get more value from that data set, and it can accelerate innovation. And there have been numerous initiatives launched over the last 20 years to facilitate data sharing. However, despite the launch of these initiatives, which are still coming to maturity, there are still large quantities of research data that are not being shared and that remain siloed, so stored behind the firewalls of institutions. In particular, this is true for data from clinical research. So a survey in 2017 of clinical academics revealed that about 30 to 40% of the 2,600 academics surveyed did not deposit their data in repositories or share them via data sharing platforms such as the ADDI platform that Tetsu described. So with this report, our overall objective was really to understand the key obstacles and facilitators for data sharing for European dementia research. So we had three key aims. First of all, we wanted to map the Horizon 2020 dementia research portfolio to really understand the scale of EU investment in dementia research. A particular goal was also to look at the proportion of projects using clinical data. So these are the data sets that are really particularly hard and challenging to share. Our second aim was to review and reflect on the EU policy and research landscape for data sharing. And this was to identify key barriers and enablers to data sharing by research projects. So these are policy barriers, regulatory barriers, but also barriers experienced by researchers and research participants that might impede data sharing. And then finally, the most important aim is to develop recommendations on how the policy context and research infrastructures can be strengthened to facilitate data sharing going forwards. So starting with aim 1 and our map of the Horizon 2020 research portfolio. So the Horizon 2020 framework programme had an unparalleled budget at the time of 77 billion euro, and this amount was distributed over a really broad range of research areas. So to analyse the dementia research projects being funded through this portfolio, we analysed the Cordis dataset from Horizon 2020, and we performed keyword searches to identify relevant projects on dementia, Alzheimer's disease, and other related disorders. This project dataset, once it was analysed, was checked for the countries in which the beneficiaries of that funding are located, the different funding schemes that were used, so the funding schemes through which that money was distributed, and also the types of data being used in the different projects. So the total budget that we identified in Horizon 2020 for dementia research exceeds 570 million euro. And this budget is just distributed across 222 research projects that involve partners based in 30 countries. As you can see from this map, there is a strong dominance of research beneficiaries in Western Europe. And in fact, partners in 9 EU countries are involved in 78% of the dementia research projects in Horizon 2020. The UK coordinates, partners in the UK anyway, coordinate 43 projects. Germany, there are 31 projects coordinated there, and in the Netherlands, there are 22. As could be expected, multi-partner collaborative projects generally received much higher quantities of funding than single beneficiary products, about 6 times more, receiving approximately 6.2 million euro compared to about 1 million euro for a single beneficiary project. And of the different funding schemes through which Horizon 2020 distributes its budget, the Innovative Medicines Initiative and the Research and Innovation Action projects received a large proportion of the total funding allocated by Horizon 2020 to dementia research, exceeding 320 million euros. So we then wanted to look at the different types of data being used in the research projects. So I mentioned just now that Horizon 2020 has a number of funding actions, and these range from single beneficiary actions that is designed to fund frontier research. This is very fundamental, usually basic research that makes cell-based and DNA-based discoveries on how diseases develop. And these actions include the Marie Curie actions and the European Research Council. So in our survey, we analysed the abstracts from all of these projects to look at what types of data were being used in the projects. And we saw that the Marie Curie actions and the European Research Council projects more frequently used preclinical data. So this is data originating from cells or from animal models of disease. However, clinical data generally was very highly used in many dementia research projects. Approximately 50% of the Horizon 2020 dementia research portfolio involved the use of clinical research. And in terms of funding, 73% of funding is allocated to projects that involve the use of clinical data. Looking at the proportion of projects within each funding action that involve clinical data, we noticed that projects funded through the IMI, the Research and Innovation Actions, RIA, and the SME Instrument Actions most frequently used clinical data. So 71% of IMI projects involve clinical data use, whereas 80% of RIA projects involve clinical data use. It's important to note that this means that data can have to travel between public and private sector participants, as well as between countries and between individual partners. And this really underlines the importance of having robust mechanisms to share data across borders and also between sectors. So our next aim was to evaluate the policy and the legal landscape for EU dementia research projects. So the EU has long realised that policy actions and governance frameworks play a major role in encouraging data sharing. And we're on the cusp, or actually Horizon Europe has just been launched about 3 or 4 weeks ago. And with Horizon Europe imminent or on the horizon, we looked back at the policy developments in Horizon 2020, reviewing the perceptions and concerns of researchers and research participants. So the OECD definition of open science hinges around 3 aspects. The first is access to publications or scientific articles. The second is access to data. And the third is a style of research. So using collaboration to really drive innovation. And in his vision that was launched in 2015, Carlos Moedas, who's a previous commissioner for research, innovation and science, framed his ambitions around 3 goals: open innovation, open science, and open to the world. Focusing on open science, 8 ambitions were included. These include fair data, as alluded to by Pavel in his presentation, open access publications, as well as some areas about research integrity and reward. To meet some of these ambitions, the model grant agreements for Horizon 2020 and the IMI included provisions for open access, and also, to a certain extent, for open data. So an open research data pilot was launched in Horizon 2020, stating that data should be as open as possible, but it could be as closed as necessary to meet any issues that projects might raise in sharing their data fully openly. Recently, last year, the 2 policy actions and policy sectors looked back on the success of the open science agenda. And they found that between 2009 and 2018, there was a doubling of the number of open access publications. So currently a large proportion, or at least half of the publications, are published in using open access methods, which meets one of the needs of open science. Within Horizon 2020, 68% of the core area projects participated in the Open Research Data Pilot, or the first phase of the Open Research Data Pilot, which is an encouraging number. However, that does mean that 32% did not participate. And the reasons that caused this opt-out were concerns around intellectual property and privacy. Moving forward, as will be shown in the next presentation, and as alluded to by Pavel, data sharing will remain a priority for the health, research and innovation and digital policies of the EU, with the European health data spaces, for example, and also white papers on AI and other data aspects. So moving on now to legal frameworks. for data sharing. So Petra referred extensively to the GDPR, which came into force in 2018. So during Horizon 20, the legal landscape also shifted fairly substantially. It did build on the previous data protection directive, so there was a certain amount of replication of content from the data protection directive into the GDPR. And as Petra mentioned, it embedded a principle, a foundational principle of data protection by design and by default. So the main goal of the GDPR is to ensure the free movement of data throughout the EU, and on the other hand, to also guarantee the right to personal data protection within, but also beyond EU boundaries. They also hoped that the GDPR would increase trust in data use and data sharing by providing additional safeguarding measures for sensitive personal data about health. To reassure researchers, a research exemption was included. This is in Article 89, and this basically means that data and sensitive data can be processed for scientific research or statistical processes as long as safeguards are in place. However, on the other hand, whilst providing exemptions and derogations, the GDPR, some researchers have argued, leaves a little bit too much room for interpretation. So, for example, there was no clear lawful basis for secondary data use, and some researchers have complained of a lack of guidance and alignment on pseudonymization and consent. And this is due to the fact that countries use the derogations to adapt regulations to their particular context. There have also been issues raised with cross-border transfers. So researchers at the NIH in the US, for example, cite complexities of arranging data sharing between the EU towards the US, and that has impeded the progress of some studies. However, there is greater awareness of data protection and greater trust in data sharing, with surveys showing that a large proportion of Europeans have now heard of the GDPR, and 33% of those surveyed indicated that they would be more comfortable to share anonymized or pseudonymized data with the public sector. However, to really go all the way towards ensuring data protection by design and by default, whilst enabling data transfers in a secure environment, we need greater convergence in data protection practices for research and clearer technical guidance for researchers. So in the final part of our report, we reviewed recent studies of researcher and participant perspectives on data sharing, trying to understand their motivations, attitudes, and perceptions of data sharing. So in general, the literature indicates that there's widespread acceptance of data sharing, both by researchers and to a certain extent by research participants who would like their data to be shared for societal benefit and also to advance research. The fact that many research funders and publishers have adopted data sharing policies has incentivized researchers to share their data. And while patients and research participants often hold strong views on who they would like their data to be shared with, in general, there is an appreciation that sharing can benefit society. On the other hand, many researchers cite a reputation cost for data sharing, particularly in the clinical sciences. These constitute motivational barriers to data sharing, and there are also concerns about the misuse and misinterpretation of data that some researchers may have spent half of their professional lives collecting. Many researchers also want more technical and financial support to share their data, including guidance on the GDPR. And there is evidence to suggest that recent data scandals have damaged public trust in data sharing. And most of the most highly cited concern by research participants and patients is loss of privacy and data misuse. Greater transparency is something that is definitely desired by many research participants who would like to be involved in decisions about data sharing. So to capture some of the comments from researchers who are working at the frontiers of dementia research, we collected some comments from leading researchers in the field, and here you can see some of their comments that they provided. These include a need to develop models for sharing real-world data. So this is data that can be gleaned from electronic health records, for example, about how we exist in real life beyond our clinical trials and clinical interactions. There was also a call for solutions that reduce fragmentation and create more unity in the data landscape, as alluded to by a number of speakers before me. And finally, solutions to enable data sharing whilst also respecting data privacy. So based on this input, we sought to identify specific barriers to data sharing in the present day, and these are listed here. So you can see that regulatory divergence is a prominent barrier to data sharing, cited by many different research stakeholders. Commercial sensitivity and IP issues are prominent for private sector organizations. And there is an appreciation that there are substantial financial and time costs for data sharing, and that researchers need more technical support to make sure their data is shared and reused. I alluded to motivational concerns and privacy concerns for the last slide. And another thing that came up in a number of studies was a lack of digital skills and data literacy in general society. And this can impede trust in data sharing. If you don't understand how your data is being used, it's hard to trust the people who are using and reusing your data. On the other hand, we also identified several enablers for data sharing, and these constitute the primary recommendations from our report. These include improved regulatory alignment and best practice guidelines for GDPR compliance, greater financial and technical support for researchers to share data, and this is including beyond the end of project funding periods. So many resources that are generated through multi-million projects are challenged by the fact that there is no ongoing support or little ongoing support to sustain these resources. Improved methods to attribute data authorship and also monitor data sharing and reuse would also increase trust and increase motivation for researchers to share. Education, training and transparency. So this is for researchers in how to adapt their practices to the GDPR, for example, but also in showing people and citizens how their data are being used and shared, and making sure that they really grasp the importance of sharing data, but also how their data are being protected. And finally, involving people with dementia in the design and conduct of research. So to conclude, we found that there is broad agreement that data sharing can accelerate scientific progress. And we appreciated that research stakeholders are developing new ways to overcome some of these remaining barriers to data sharing. These can include codes of conduct for GDPR and also the creation of new platforms that are addressing the issue of fragmentation across the data landscape. Moving forward, we need to think about what data is being shared and how it is being shared. So really understanding the examples of best practice that are at our feet. We also want to understand the gaps. So just as important as knowing what data is being shared is knowing what data isn't being shared and understanding why that data isn't being shared. And finally, as alluded to by previous speakers, there is an amount of learning that we can do from the COVID-19 pandemic. So in the last year or so, the power of data to drive policy making for societal benefit has really become very prominent. And it's shown that collaboration and data sharing can occur on a global scale. So we need to build on these learnings to understand how data sharing can support policy making and ensure that the promise of data sharing is also benefiting dementia research and people with dementia. And I'll leave you with a comment from one of the contributors to the report, Professor Craig Ritchie. And yeah, I think it resonated on a number of levels. And he stated that as custodians of data, it is our responsibility as researchers to ensure this data generates as much knowledge as possible. This means making the data openly accessible at scale and in the long term. Thank you very much.